Good afternoon. I'm here at the Nashua Police Station to update you regarding the status of the city's anti-COVID-19 efforts. I'm joined, and you'll see them in a few moments. I'm joined by Bobby Bagley, who's Director of Public Health and Community Services, by Justin Cates, who is the Director of Emergency Management, and with Lisa Foto, who's the Director of Public Works. And we're all going to talk about different aspects of the city's response. But before we get into the details, we are, as you've probably learned from the governor's emergency orders, moving towards gradual reopening. But I want to be very clear and honest with you. Things will not return to the way they were before COVID-19. We will open, we will reopen, but many things will be changed, and we're not really sure how they will be changed, but we know they will be. I get that this is a hard time for you. I get that this is a lot to go through. For example, we have 7,600 people here in Nashua who are unemployed. I get that it's very hard on those families. I have a friend, and I know many of you know people who might have gotten COVID-19. My friend is in bad shape. It's a hard time for the families that are suffering through something like that. I know that that you feel anxious and sometimes a little depressed about having to stay at home. This is difficult, and I certainly get that. But we are doing something important, and we're doing this together. We have unity here in Nashua, and we're working to combat this virus, and we're doing something important, and what we're doing is we're saving lives. And that's why we are suggesting and recommending and taking all of the actions that we are taking. City Hall hasn't been open for many weeks, 6 or 8 weeks. The governor has closed many businesses. Again, those will be gradually reopening. But we together, by taking these steps, by wearing our masks, by exercising social distancing, we are doing something important. We're achieving something significant, and I think we will look back on all of this and say that together we did something very meaningful. So with that, I want to get into some of the details regarding the situation here in Nashua, and we have some slides for you. The first slide shows us the new cases per day in Nashua. Now, it's a graph. It shows up and down. We run, and the most recent day is not there. Yesterday, we came up with 20 new cases. We now have a total of about 280 cases. But we've only done limited testing. This Public Works is really gearing up for that, but we are subject to state limitations and the limitations of the amount of tests. So we're testing more people, and the number of positive cases is going up. Now, to be frank and honest, this 280 probably understates the number of cases we have here in Nashua because there has been only limited testing. We know right down the road in Boston and in northern Massachusetts, there are a lot more cases than we've identified here. Boston is a national hotspot for the COVID-19 virus. But our goal is to, as time goes on, limit the number of new cases, keep seeing that number going down. That's what we're looking for. Public health, now why don't we go to the next slide, which is the testing that's been done in New Hampshire. Now you see from this slide that the number of tests has gone up very rapidly. For some time, we were extremely limited. Now, across the state, I believe 2,000 tests were done yesterday for COVID-19. Here in Nashua, we've been running clinics, and you'll hear about this from Bobby Bagley, running testing clinics every so often. Yesterday, there was one, Tuesday, Monday. And we will continue with that to identify as many positive cases as we can and to help us develop a plan of action moving forward. The total number of cases in New Hampshire, you can see, is up to about 35,000. Still not enough. We need to keep pressing on this front. The next, but before I leave the testing, for example, on Monday and Tuesday in Nashua, we did about 160 tests. The results, and Bobby can give you the exact figures, have come back on about 110 to 115 of those people. And we identified from that number, 110 or 115, 11 positive cases. So that is a 10% rate, and people who've tested positive among those who are being tested. That's not, that number alone, if that's all we had, that's not good news. Are 10% of the people in the state, in our community, positive for COVID-19? Probably not, because most of the people being tested are probably, most of them are symptomatic, but not all of them. And so we look at that number, and we want that number to go down. We want there to be less cases than that, but we don't know really what that means. 10% of the people come up positive. That's why we need to do more testing. We need to find as many people as possible who we can test, and over time establish really how widespread this virus is in our community. The next slide is the persons being monitored for COVID-19. Now, this is a statewide slide. It shows that there are many people being monitored for COVID-19 virus. Right here in Nashua, our public health nurses are tracing each positive case. So we've had, as I said, about 280, but around 100 of those cases are still active. They haven't recovered. And so our public health nurses contact, of course, each person who's tested positive, as well as all of the contacts that they've had in the days before they contracted the disease. And they work with those, trace those contacts, work with them, counsel them, instruct them to quarantine themselves. So right now, public health, and Bobby again can give you the exact figures, but right now public health is working with about 120 contacts around Nashua, telling them they should be quarantined, isolated, so that for 14 days, so that they don't spread the disease to someone else. And finally, I think that's all the slides we have. Oh no, there's one more slide, the test percent positive slide. This shows you a graph that suggests that statewide we're seeing about 9 to 10% of the people who have been tested testing positive. Again, if that, we don't know the meaning of that, but it's certainly, that's not great news. But on the other side of the coin, the number of cases is, the new cases is fairly constant, 100 or so in New Hampshire over the last couple of days. So I'm going to turn this over to Bobby in a minute, but I'd just like to say again that we are in this together. We're fighting this disease. We are doing something meaningful. We are saving lives. If you know the family of a person who has contracted the disease, who has passed away, you'll learn that the family members have to go in and see the patient for the last time in all kinds of protective gear. They're not allowed to visit during the course of the disease. This is a tragedy for any family. And what we're doing by working together is making sure that that happens as infrequently as possible. So I want to, of course, encourage you to wear the masks when you go out. That is one way to limit the spread of the disease. You know, when I go out, I ask myself, you know, do I really have to wear this into the pharmacy? Do I really have to wear this into the grocery store? But the answer really is, if we are going to be unified and together, if we're going to prevent the spread of this disease, the answer is, the truth is yes, we really all need to wear these masks. Today we are socially distant. There's a bunch of other, 4 or 5 other people here, but we're more than 6 feet apart. We all need to continue to exercise that caution in the days ahead. So we'll be back in another week or so to update you. I hope you find our information sessions useful. And with that, I'm going to invite Bobby Bagley up, Director of Community Health and Public Health and Community Services, to update you with some more slides about more of the details concerning our anti-COVID-19 efforts. Thank you.
Thank you, Mayor, and good afternoon, Nashua. I'm here to just give a brief update on some of the numbers that you've been hearing about, that you possibly and hopefully have been seeing on a daily basis. And it's important, we share this information because it's important for us to see how things are evolving with our response to COVID-19, and to give these updates so that you can see where we are and understand the seriousness of our response and why we are responding in the manner that we are. The slide that's behind me, or that you see, actually shows the global update, where there's over 3.8 million cases around the world, with over 270,000 deaths, and that number just continues to increase. In the United States, there's 1.25 million cases that have been identified, with 75,000 deaths. Again, these numbers continue to increase, and they're numbers that are increasing with our most vulnerable populations, as well as with individuals that have other health conditions like asthma, hypertension, obesity, diabetes. These are individuals that are impacted the most by this disease. And yes, when you hear me speak, you're going to hear me say the same things over and over with the redundancy to help us all understand the importance of what we're doing, the impact, and why we individually have to look at our own social behaviors to help protect our most vulnerable populations. In New Hampshire, we have over 2,843 cases, and I say over because the numbers that we get are usually the day before. And so each day there are more and more cases that are reported as we do more and more testing, which is really important for us to understand what's happening in our state. At least 41% of those individuals are recovered, and 11% have been hospitalized. And so what that means is that there are individuals who, for the most part, when they contract this disease, some can be managed at home because their symptoms are mild or not as serious enough for them to have to go into the hospital. But at least 11%, 1 in 10, have to go into the hospital. And that can be devastating for that individual as well as for their families. We're up to 4% of the individuals that have tested positive and are being treated have died. And that has been in, again, that population of individuals that are in our nursing homes, individuals over the age of 60, and individuals that have other health conditions. In Hillsborough County, we have over 1,000 cases, 1,308, with 43 deaths. Again, these are all very significant numbers for us. In public health, we monitor these numbers because it helps us with our mitigation measures and our factors. It helps us to educate our population on the importance of, again, us changing our social behaviors, because the virus needs us to spread, right? And so we can take action to help stop the spread of it. In Nashua, as the mayor said, we have over 278 cases, 97 active cases. That's 97 individuals that our public health nurses are following, with over 145 contacts that they're monitoring as well. This takes a significant amount of time, but the importance of this is, again, to identify individuals so that they will know. Once people know their status, once people learn about them being infected with COVID-19, they do change some of their behaviors, because we ask individuals to go into isolation to protect their loved ones or to quarantine themselves from the public so that we don't continue to spread this infection. We've been steady at 8 deaths, which is a good sign for us, but 1 death is too many. We have about 57.9% recovered, which is also good, meaning that we have a lot more milder disease that we're seeing. With that said, and as the mayor has mentioned, we're working together as a community, and we need to continue to do that so that together we come across on the other side of this as a healthier community, doing well together. So let's all do our part to stop the spread of this disease. I'm going to turn it over to Justin, from our Office of Emergency Management. Thank you, Nashua, and continue the good fight.
All right, good afternoon. So I wanted to just briefly update everybody on our task forces that we've established here within the city to focus around the long-term recovery for COVID-19. Bobby gave an update on the Public Health Task Force, which has been really the forefront of all of our testing campaigns, as well as the contact tracing and making sure that our community is healthy during this recovery. Municipal continuity is the other task force that's been significant over the past few months. The major issues that we've been working on related to municipal continuity over the last week surrounds the opening of some of the services within the city. Our division directors have done a really good job at working with their staff, working with the supervisors to ensure that all of them are working on efforts to continue services as best as we possibly can during this crisis. The challenge, however, is working remote does present some issues for those employees that have to work out in the field. In those cases, we work to try and provide the right personal protective equipment, as well as modifications to their work efforts so that they're maintaining physical distancing and working to stay as safe as possible. Some of the concerns that are coming up in the coming weeks around municipal continuity is really as we start to reopen some of these other community services like restaurants and retail. Many municipal employees are involved in the permitting, licensing, and enforcement of those types of activities. So our folks within the city are working to identify which employees might need to be brought back to ensure the safe reopening of many of those services. For the Economic Recovery Task Force, some of the efforts that we've been working on with that team have been the COVID-19 Impact Fund, which was just recently released, and folks within the nonprofit and business community, small business community here within the city can apply for funding through that program. The information on that can be found on the COVID-19 website on nashuanh.gov. And that's something that's been done in combination between our Economic Development Division as well as the Community Development Division. So for those that are experiencing hardships within small businesses and those nonprofits here which are essential in our community, we want them to explore that COVID-19 Impact Fund. The other things that we're working on related to economic recovery look at the reopening of some of those services that we had mentioned earlier. We've gotten a lot of questions from businesses about what types of precautions we need to put into place related to safety within our organizations. The state of New Hampshire on their New Hampshire Economy website has information about all the guidelines related to opening up your business or organization moving into the Stay-at-Home 2.0. There's guidelines that are specific to certain sectors. As an example, you'll find some that are focused around restaurants or retail or manufacturing. But there's also some guidance that's been provided for all organizations regardless. And even those businesses that have been open over the last month and a half, 2 months or so, they need to start following those guidelines. And that includes making sure that there's protections for employees, screening for employees, things that will help to keep our whole community safe. The Homeless Support Task Force has been working on continuing to monitor the issues that our shelters and support services might be encountering during COVID-19. When you look at some of the issues that we're seeing across the country with homeless populations that are being negatively impacted by COVID-19, it's remarkable how well we're doing here in Nashua. That task force, as well as the support organizations here within the city, have done a great job at keeping their shelters safe and also dealing with some of the emerging issues that are in that population. The Child Care Task Force has been focused around looking at those summer programs that were unfortunately having some challenges getting reopened just due to the requirements that are necessary for physical distancing and to try and keep all the children that are safe in those programs. We continue to take information from the governor's economic recovery reopening task force. That task force has looked at summer camps and day camps and those types of activities pretty closely, and they hope to release some guidance here within the coming weeks. We're hoping to take that information and provide some technical assistance to those summer programs here within the city and assist them where possible getting opened back up. The other concern for Child Care Task Force is around the need for child care services as we start to reopen some of these essential services. So as you start to see businesses and restaurants reopening to some extent, those employees are going to need to provide some child care access to their children, and we know that many of those child cares have been closed over the past few months. The School Issues Task Force, we did hear from Dr. Mosley earlier today about some of the efforts that they're doing around the planning for the last few weeks of school. There's a massive effort that's going to have to take place to get those Chromebooks that they distributed back to the schools, as well as the startup of their summer programs. They also, like many of us, still have to continue to provide services throughout the summer, even though it might be different than what they've been doing over the past few months. So they're working on planning for that currently as well. And then the last item that I wanted to mention was the Community Distribution Task Force, which has seen some great work accomplished over the last week or so. The efforts around their program to get food from many of the small grocery stores, as well as some of the larger grocery stores around the greater Nashua area, to help distribute to our community nonprofits was a huge success in conjunction with the work that the United Way had done. In the coming week, some of the things that you'll see around community distribution are some significant distribution efforts of cloth masks. So there's some work that's being done by the Nashua Rotary to distribute masks, and that'll be announced here within the coming days. United Way is also looking at some ways to distribute cloth masks here in the coming weeks, and we'll be able to push that information out through all of our channels here within the city. So I'm really proud of the work that all of our city departments, the divisions have done, but more so I'm really proud of the work that those businesses, the nonprofits, and those community partners have done to work with the city towards this long-term recovery for COVID-19. I think as long as we keep working together like this, we'll be able to get through this. So next, I'm going to turn it over to Lisa Foto, our Director of Public Works, who's going to talk a little about some of the work that they've done over the past few months. They've been doing some remarkable work at keeping those services up and running, even under these very difficult circumstances.
Good afternoon. As Justin said, I'm very proud of my staff. They have really risen to the challenge of working during this pandemic. It hasn't been easy. We've really been able to hit the ground running from the very start and continue city services and continue to maintain our infrastructure. Of course, that hasn't been without modifications. We do wellness checks. We stop our folks from congregating in our break rooms. They're no longer allowed to do that. We are working in smaller groups, and of course, we're wearing masks and using PPE, things like hand sanitizer, and also sanitizing spray in our equipment and things of that nature. But we are continuing to, and I'm going to talk a little bit about some of the things that are still going on in our community, some positive things. Our 2020 paving program is in full swing. This year we will be paving about 25.5 miles of streets, which it works out to about 103 streets. We've already paved about 7. We'll be crack sealing about 34 miles or 175 streets this year. We've already sealed 27 streets. Our daily and weekly work continues. We are doing street and sidewalk sweeping. Trash recycling and soft yard waste is being picked up. We're repairing potholes. We're doing sewer repairs. We're maintaining parks. And very soon you'll see us planting flowers all in the downtown. So that'll be a positive change. We are overhauling many of our parks. We're working right now on the Greeley Park boat ramp. Many of you have probably seen. We're almost finished that project. All we have left are the detention basins and the parking lot. We have finished the Roby turf, and the shades sail installation is now complete. We can't wait to open that park, along with the Salem Street tot lot that also just underwent a major overhaul and is ready as soon as we can reopen it. We also will be making some major modifications to Lincoln Park this year. We're really excited about that. Any of you who are familiar with Lincoln Park know that there's a lot of heaving from the old landfill that's there. So that will be corrected this year as well. Our landfill work continues. We are very soon going to be starting to fill in our Phase 3 landfill. That is complete, as you can see on the slide. And we are working on permitting our Phase 4 landfill. The Phase 3 and Phase 4 landfill will give us another capacity of about 50 years of landfill space. So that's really significant and great for Nashua. Our recycling center has had limited use. We have not been selling permits. We haven't been selling recycling toters. We haven't been able to take fluorescent bulbs and some of those things. We are working on getting that back in service again. So in the next couple of weeks, you should be able to do those things again. We also hope to start picking up oversized items or bulky items as of June 1st. So that service will be back. And at that point, we'll be back to providing all the services that we normally perform. Our household hazardous waste program is, however, on hold, and we will certainly keep you all updated as to when we can start that back up again. Looking forward, we get a lot of questions about when our playground's going to reopen. When are we going to open pools? Are we going to have summer camps? What's going to happen for the 4th of July? How about the summer fun program? And Director Cates just spoke to that a little bit. I'm talking with Director Cates, with Director Bagley, with Heidi Peak of Environmental Health. A lot of us are talking about that. We all want to see these things happen, but we have to do it safely. We're waiting for some direction from the state and from the governor, as Director Cates mentioned, and know that whatever decision is made, we will do so in the best interest of Nashua residents, and we certainly will do whatever we can to make some of these things happen. Will they look like they normally do? Absolutely not. But we'll try to bring them to you in some form or another if we can. We have some upcoming events coming. We are working on a banner that will go across Main Street that will celebrate our class of 2020. This is a tough time for those kids. I know that personally. I have a senior who is really struggling with being home and not being with her friends and not having that closure. Our hearts definitely go out to all of the families and kids in that predicament. But we do have a banner that will be across Main Street celebrating you. We are also planning to celebrate Arbor Day next Tuesday at 9 a.m. We will be planting a tree. The mayor will be leading the ceremony, and we will be planting a tree at Nashua South and at Nashua North in honor of the class of 2020. So we're really excited about that. And we will have, I think, some school officials there. And I know the school department is planning a whole other host of events for you. We also have our military tribute banners, which will be going up as of Memorial Day. They will be up from Memorial Day until Veterans Day. Stay tuned for more information on that. We will have we wanted to have a big ceremony, but the mayor will be hosting a smaller ceremony for that, and we're very excited about that. We'll be putting up 38 banners on the Broad Street Parkway. So they're very large banners. They're 29 inches by 100 inches, so they'll be very nice. And I think that's all that I really had to update you for now. We are definitely here for you, Nashua. If you need us, please contact us. The best place to reach us is a DPW request at nashuanh.gov, and we will do whatever we can to help. Thank you.
So this is, thank you, Lisa, thank you, Bobby, thank you, Justin. We do take questions from the press if anybody is watching, but Carrie is monitoring that, and we've gotten no questions. So just to conclude, in addition to fighting COVID-19, we are, of course, engaged, as you heard, in our recovery efforts. We have the COVID-19 Recovery Fund, which will grant small loans and grants to small businesses who are hurting, as well as the nonprofits that have been hurt by the COVID-19 virus. We are also beginning to think about how to reopen some of these small businesses, restaurants on Main Street by allowing more use of travel lanes with safety protections, of course. But please, if you have questions, don't hesitate to contact the mayor's office, contact City Hall. And if you want and believe you should be tested for COVID-19, please remember that you need to make an appointment, but the tests are available on various days. You need to call 589-3456, which is the Public Health COVID-19 hotline. So thank you, and we'll see you again in about a week.